I would like to introduce Dr. AlMulla. She's a clinical lecturer in radiological science at Kuwait University, hold a PhD in magnetic resonance imaging from University College Dublin, Ireland, with the over decade of experience in MRI and diagnostic image. She is specialized in musculoskeletal imaging and quality assurance. Her research is widely published in international journals, and she has presented her widely published work in major conferences, including the European Conference of Radiology. Dr. AlMulla dedicated to advanced radiology standard in Kuwait, and through her roles in teaching, research, and professional development workshop. Please welcome Dr. AlMulla.
Okay. Can I ask my audience, it's a request from me, if you indulge me, and anybody who's sitting in the back can come and sit in the front. My lecture is the last lecture. You don't have to sit in the front throughout all of the lectures, but could I just see your faces? Please, please, please come. There are so many chairs. Please, please. I love to see your faces when I'm doing the lecture. Please indulge me. Come into the front. معلش نسوي رياضة الصبح. Please, can we come into the front?
Thank you, everybody. Thank you for giving me this pleasure. First of all, I would like to welcome my colleagues, my juniors and seniors, our esteemed international guests into day 2 of our Kuwait conference. And I'm Dr. AlMulla. Thank you, Rasha, for introducing me. When the organizing committee have approached me to present artifacts, and I read the title, to myself, I thought, probably a radiologist have written this, not a radiographer, because no self-respected radiographer think of artifact as guests. We think of them as pests, and we'd like to get rid of them when they appear in the image. So I took it upon myself to radiography my title, so MRI Artifacts, the uninvited pest in your image. Because artifact is a big world, and I only have 20 minutes to introduce it to you, I will talk about MRI artifacts and the challenges with concentration on recognizing the artifact and also managing and correcting the artifact. You can find information about artifacts in sources, resources, and in the internet. ChatGPT is a great source to learn a little bit about artifact. I don't mind that. So I recommend you do a little bit of reading about different sources and different types of artifacts. So if I give you this image, for example, what is the first thought that comes into your mind? I'm pretty sure a lot of beautiful words and beautiful ideas comes into your mind. Like, for example, this is a good image of brain anatomy. Sah, correct? This is a good image of normal brain. This is nice. This is approved. Sah, right? Right? See, I can hear you. What about if I change to this? Your beautiful, positive images goes into a little bit of negativity. I don't like this. You need to change this. You need to fix this. It is not diagnosable. So it goes into a little bit of negative feelings. Why did I put this as a reference is because the first image gives you a little bit of information about the resolution of the image, the construction of the image, and the second one, you directly know that there is something wrong because it's a big difference. So it is very important to know about how an image constructed so we could know the difference between a good image and a bad image. So شكرا للدكتور عبد الله والدكتور عبد الحميد والدكتورة عذاري. Yesterday they've given us a big introduction about how an image MRI is constructed and how we see a sequence. Basically, an image is constructed from the hydrogen atoms. We get a signal. This raw data is then analyzed and we get an image. We get an image as a combination of signal resolution, noise, and contrast, and artifact. Artifact is a part of image reconstruction. So we need to know about this item and how to get it out or get it into our image. Artifact, as we all know, can degrade an image. So our hope is always to minimize it, and we can always minimize that by knowledge. Obviously, the technician has to have its knowledge and capability to reduce the presence of artifact. We can also use preventive measures and corrective actions. But using corrective actions and preventive measures has to rely on your knowledge and your way to kind of like implement that into your practice. So the key, before I start diving into the artifact world, is to always understand what you are creating and then apply what you have learned to reduce artifact. Okay, I have a story for you here. Let's assume that this is a person and he was doing an MRI. Let's call him Mr. Sir. And Mr. Sir did this MRI evaluation. And he saw the image and he says, I don't think I like this image. I want to change it. So he went and changed it. So the best thing he would do to improve an image is to increase your necks, right? صح? Or I'm old-fashioned with my information, you can do more things. But the best thing to do is to increase your necks. But what does necks do? Increase? Increase? Yeah. So SNR improved and time increased. And you're doing an abdomen and you have time increased. So, of course, that's unacceptable. So Mr. Sir, he goes again and think about something else. Let's see what he did. Reduce field of view. What did he do when he reduced the field of view? He introduced a new artifact. Do you know what it is? Wraparound artifacts, huh? So he introduced an artifact. Scan time is reduced. SNR is also reduced. So he did something wrong. Let's fix it again. He increased the scan percentage. Scan time is reduced. SNR is reduced. What did he do then? He produced a new artifact, fat registration. So he tries again. Oh, and so resolution is worse as well. So he tries again. No fat misregistration. Scan time is reduced. Oh no, resolution is unchanged, but SNR is reduced and the image is not diagnosable. So what does he do again? He goes back to 0. So the moral of the story is 2 things. If it's not broke, don't fix it. And if you're in doubt, always start from 0. Don't go again and doing all your changes if you don't know what you're doing. Just go ahead, delete whatever you're doing, and start over with somebody that you trust. So what I want you to take before I dive into artifacts, always know what you're doing, always have confidence in what you're doing, and always try to have as much knowledge when you are going through the MRI and changing the sequences. So, MRI artifacts, what do we know about them? They're just a pest, they come into the image, and they change things. But they hide. You have to have your knowledge, you have to know what you're doing. For example, if I give you these 3 images, can you tell me which one is a pathology? Okay, I'll make it easy. Is it the one on the top? A show of hands who thinks the one on the top is a pathology. I need to know your name, guy. You're so amazing. A show of hands who thinks this is a pathology. I would think so. And the shoulder, who thinks that's the pathology? Who thinks the knee is a pathology on the bottom? Okay. So the actual pathology is that one. These two are artifacts, and you have to watch your image. Okay. Why did I put that? Because artifact has a dual nature. Sometimes some of you think, oh, we don't need them, they're past, and they can degrade the image. But no, look at that image of the cardiac here. Look at that image over there. You'd think that's an artifact image, but no. This is an artifact we produced. It's called triggering to get that nice image over there. And if we look at the images on the top, you'll think all of these are similar artifacts. But in reality, for the seniors, they know that the one in the bottom, the axial one, is crosstalk. The one on the top is susceptibility. But that one is something we put in the image, right? What's it called? Sat bands. We put them in the image to reduce motion, right? And the one in the bottom, obviously, is the magic angle effect. And how do we find this pest? Is you have to see it in multiple images, in multiple scans. So you have to be aware of what you're looking at, what you're scanning. If you don't see it repeating, then you have to repeat your scan and change your positioning, right? Not the patient positioning, your planning. So, another thing I want to talk to you about artifact is your experience, what you face on day-to-day basis. For example, if I show you this, hello, one of them is a pathology and one of them is not. I know this is not an MRI, don't attack me, it's an X-ray. So the first one is an actual pathology of the patient. This is not something you have control over. The second one is actually this patient having a nice hair day. So what do? When Dr. Adari told us about AI can't take that job away from us, right? He cannot observe the patient. He cannot say what he sees. And also, this is nice experience you have as you go on doing your clinical. This slide is put here to encourage juniors to have a journal, to write things, to write their experiences. When I first started MRI, I think one of the people who were working, when I asked them a question, they just opened their dusty journal and they just tell me things that they have faced over the years. So I really encourage juniors to have their own notes, write some things about the patients that they have only seen, and then they share that, even with a meeting or have such a conference like this and just share their notes. I mean, that's just valuable information going around, right? Okay, so let's get serious. There are different types of MRI artifacts. I have a few of them. And the thing about MRI artifacts, they don't just come straightforward. They come from different sources. For example, the famous motion artifact. It can come from a patient. It can come from encoding. It can come from signal processing. We also have susceptibility. It can come from the magnet or from RF. We have aliasing. It comes from encoding, signal processing, Gibbs, and chemical shift. They all can come from different sources, and you all have to know where is this artifact coming from. Specifically, chemical shift, we use it in Dixon, right? It is not an artifact now, it's a sequence. And we still have to know the difference if what's happening is as a result of the sequence we actually are applying, or it's an artifact because the chemical shift didn't happen and the separation didn't happen accurately. صح? So the journals and everywhere, they kind of categorize artifacts into 4 major categories. We have patient-related categories, and then we have equipment-related artifacts, and then we have physics-related artifacts, and then finally we have software or image processing-related artifacts. Okay? Ways to limit artifacts. Dr. Abdelhamid has already explained the first one, is to always communicate. Patient preparation, patient positioning, patient care. It is part one of eliminating artifact. Okay? Then you have hardware calibration, separating your fat and water, optimal scan parameters, Mr. Sir, if you remember him, and also post-processing technique filtration. These are just simple ways you could use to improve image artifact. طيب, how do we apply that in clinical practice? I have suggested a technique. It is mine. I created it, but you are free to use it. It is called RAF. RAF basically stands for Recognize, Organize, Fix, and Finalize. It is a step-by-step methodology you could use in clinical practice that can help you eliminate or work through your artifact problem. Let's try to do that. First of all, we see this image. We can see that there is something fishy going on the top. Some oscillating or ringing, high contrast changes. You can recognize that as, anybody can tell me what kind of artifact is it? Gibbs artifact, thank you, Dr. Abdelhamid. So we acknowledge that this is Gibbs. And then we try to fix it. How do we fix Gibbs, guys? Any ideas? It's written on the, Can you tell me? We can either increase the matrix size or use zero fill K-space or use filtration. So we apply these and then we redo the scan. Simple? What do you think? Simple? How about we do it together? Okay. I have my lovely assistant Ishaq here. He is helping me to introduce this scenario to you guys. Speakers, you can participate as well. So I have a scenario. I have an MRI scan of a brain with the patient is slightly claustrophobic. All right? So what can you expect from a claustrophobic patient? Motion. So what can you see? Question 1. Can you identify what is strange in this image? Raise your hand if you want to participate, please. Okay, we have a participant over there. So, what do you see?
This is movement artifact, I feel. Motion artifact.
Motion. We see some bright signal and blurring. Okay. Thank you, sir. This is a type of artifact. What is the name of this artifact? Anybody, please, just raise your hand. Come on, our lovely assistant wants to move. Give him his time to move. Anybody? Do you know what's... منيرة ساعديني صيدي أحد من الصباح. What's the name of this artifact?
Blurring artifact.
Blurring or patient?
Or?
Motion.
Motion blurring artifact. Motion cause blurring artifact.
Yes, يعطيك العافية. صح. So, motion artifact. What can we do to fix this problem? آخر هدية.
Talk to the patient. Talk to the patient.
أحد من اللي قدام. إسحاق من اللي قدام.
ما في مصدقين.
دكتور تساعدنا. دكتور أي أحد. What can we do to fix motion artifact?
As a moderator, can I participate?
إيه لا أكيد. دكتور.
Talk to the patient. Explain it well to the patient.
So the best thing to do about motion artifact is communicate with the patient or talk with the patient or use filtering type of post-processing to correct that. So we apply that. And the best thing also to reduce time. Moving patients don't like to stay, claustrophobic patients don't like to stay in the scanner also. So we reduce time. Not use 3 necks. Sir, Mr. Sir, remember him? Then we apply that and we see how it goes. So, obviously when we have MRI, we'll always have to talk about new things, AI and whatsoever, and the research things that they have to introduce and make our life difficult. Obviously, they gave us all of these new things, all of these new artifacts that we have to go through. Some of them Dr. Adari have mentioned yesterday, thanks to her, and some of them are quite new in homogeneity, the new parallel imaging, every parallel thing they create with it a perfect artifact that we have to deal with, right? And we have to learn, right? So yeah, they're giving us a headache, aren't they? And then our radiologists, they don't use them. So we just learn them for nothing. And obviously, when you increase the Tesla, you have more noise, thermal noise, MRI acoustic noise. They all create artifacts. Oh, let me just go back to that one. And with new machines, obviously new implants. And with every new implant, you create new artifacts that we also have to learn about. Okay? Ways to correct that. We have also AI. It creates a problem, and it fixes the problem at the same time. Magic, right? So AI can correct problems, and we have improved motion. And we also have this new idea that we can use CT or hybrid sequences like CT MRI or PET MRI. What we can't see in MRI, the CT and the PET scan can overcome that and provide the information we are looking for, right? So, in conclusion, what we learned today is MRI artifacts obviously have a severe impact on our image. So understanding them and understanding their causes can improve our clinical outcome. Always, always consider the type of artifact and its potential source when you are trying to correct your artifact. Use techniques and post-processing scan to reduce and eliminate artifacts. And also understanding and managing MRI artifact is a skill that we work on and we enhance throughout our clinical journey. Thank you very much. Appreciate it. And